Well, I had annual physical with my primary, and checking the PSA had gone up 1 point. The top number was not huge, but because it went up a full point in 1 year, primary suggested that I go to a urologist, and so they referred me to Georgia Urology. Theodore, go by Ted Sawyer, um, Houston, Georgia, where I live here. After I had, one appointment for a consult, um, they immediately made the next appointment. There was no issue, and they could work around a little bit some of the other things that I had, on the calendar. So it seemed to be very flexible with that. Like I said, everybody was very pleasant, and I guess they seemed to be really interested in my situation, not just another number or whatever. So I think that was a real plus. Well, initially they did a biopsy of the prostate, and so subsequent to the biopsies, I met with Dr. Sharp, and he laid out a few different possibilities, one of which was the NanoKnife. Um, he said he favored that because it specifically can zap the tumors, not like radiate the whole thing or, a full removal, and much less side effects. That was one of the primary factors. There was cryosurgery, or something called HIFU, which is a high-intensity focused ultrasound. But he said he felt this had the best, I guess really the best success for particularly what my situation was. It's a needle, I guess you call it, also an electrode, and it goes in and specifically targets a cell, one of the, 4 cells. It zaps it. It's an electrical charge, as I understand it, that breaks the cell, opens it up, and the cell dies. And so each of those, cancer cells or tumors, whatever they want to call them, you can pinpoint instead of just, like I said, if you had radiation or something, it disturbs the entire prostate. And that's, I think, when you do have a lot of other side effects. Well, anytime that you go out, with anesthesia or whatever, there's always, some risk. I'm 81, and I've had a lot of other issues with melanoma cancer and so forth. So, but I think just in talking with Dr. Sharp particularly, I was very comfortable having it done. Back on the golf course, so that's good. That's my primary hobby. Not that you need to know, I shot my age twice, so that was that was kind of a real bonus. I didn't think that would ever happen. Say my primary, I thank her for at least picking up on that. I wasn't sure, something goes up 1 point, well, it doesn't seem like a lot, but in a year period, that's considered significant. So I'm glad that she referred me, and of course that she referred me to Georgia Urology, and I will pass that along probably next time I see her for sure.